Before entering the room, I would check the electronic medical record to see if there's any new lab tests that I need to be aware of or any new orders. I'll also check to see if there's any orders that I haven't completed yet. Along with that, I'm going to check the door to see if there's any signs or markers indicating anything I need to be aware of, such as a fall risk. I don't see any of that, so I'll just go ahead and head in. Hi, Brittany. My name is Maddie. I'll be your nurse today.
Hi.
Can you go ahead and show me your name band, please? All right, and what's your name and date of birth?
Brittany Brisbane, August 6, 1999.
Fantastic. All right, what brings you in here today?
I've just been having migraines and they've been really bothering me lately.
Oh, okay, yeah, we'll try to take care of that. So, what's been making them worse right now?
Usually when I'm in like direct sunlight for a while, bright lights.
Is there anything, has anything helped make them better?
I haven't really tried anything yet.
That's all right. And where is the pain located?
Usually like right behind my eyes.
And is it radiating anywhere?
Not really.
Not really? Okay. And if you could describe the quality of pain for me, is it sharp, throbbing, dull?
Usually pretty sharp.
Sharp. All right. And on a scale of 1 to 10, how would you rate it? 1 being not too bad, 10 being unbearable.
Probably about a 7.
Okay, yeah, that's pretty bad. And when did you start having these?
Probably when I was like 12 or 13, and then they've just been going all the way through.
Kind of got fed up with them?
Yeah.
All right, we'll try to take care of that today. So we just did PQRST, and now I'm going to go on to taking her vitals. We'll start with temperature. All right, I'm going to be pulling up and back on your pinna. And she's at 98.5, which is within normal limits. All right. Next, I'm going to be putting on this to check your pulse ox, and this is just seeing your oxygen levels. And while that's going, I'm going to go ahead and set you up to have your blood pressure taken. All right. And your pulse oximetry is at 98, which is also within normal limits. All right. Before listening, I'm going to palpate your blood pressure manually. So I'll just find your brachial pulse. All right, I started feeling it around 22. We're going to go ahead and let your arm rest for a second, and I'm going to listen to your heart. While listening to her heart, I will be checking her apical pulse rate. I will be reaching up underneath your clothing, just so you know. I'll be listening for a full minute. While checking her apical pulse, which is regular and strong at 75 beats per minute, I also check for respirations, and those are at 16 per minute, which are both within normal limits. All right, now we will check your blood pressure manually. I got 128 over 75. Is that normal for you?
Yeah.
Fantastic. Now that I have finished with vital signs, I'll go ahead and check her neurological systems. First, I will start with the Glasgow Coma Scale. Her eye-opening responses have been spontaneous, and her movements have been purposeful. Her responses to any of the questions have been well organized and appropriate. Next, I'll go on to check her eyes. I'll check her pupil area responses to direct and consensual light along with her pupil size. Your pupils are about 4 millimeters in diameter. Alright, and her eyes will respond to both the consensual and direct light. Next, I'll go on to see if she has any facial droop or apoptosis, which she doesn't have either of those. I also assess to see if she's able to swallow water, which she can. Brittany, now I'm going to be checking to see if you're able to feel light touch. So I'll just be touching you like this. And you can go ahead and close you have your eyes closed, and you'll just point to where you feel it. All right? Fantastic. Next, I'll have your arms and toes like this, and I'll just move them up or down, and you're going to tell me which direction I'm doing that. Go ahead and close your eyes again.
Up, down, down, up, down.
Great. You can go ahead and open your eyes. Now that I'm done with the neurological assessment, I'll state her general appearance. Throughout the exam so far, Brittany's face has been relaxed, and there's no tension or distress. Her body posture is relaxed, and she has proper body alignment. Along with that, I've been checking to see if she's alert, and so far she is. Brittany, I'm also going to check your level of orientation. So, do you remember my name?
Maddie,
And do you know where we are?
in the clinic.
Fantastic. And do you know what day it is?
It is Tuesday.
Good enough. All right. So she is oriented to person, place, and time. I've also noted that her hearing is she has good hearing ability, as she's been responding to my questions appropriately, and her speech has been articulated and purposeful. Along with this, I've noticed that she doesn't have any hygiene problems that we need to take care of right now, as there's no odors. Next, I'm going to go on to respiratory. With respiratory, I'll be listening to both the anterior and posterior sides, and I'll be checking 6 areas. So far, I've noticed that she does not have any labored breathing, and that if she did have a nasal cannula or oxygen mask, I would check the flow rate and the fitting of that mask or nasal cannula. Great, I'm just going to lift this up. I'm going to continue on the back, and I'm going to listen to 6 to 8 areas here. I'm listening for 1 full respiration. I've noticed that all lung fields are clear and there's no adventitious sounds that I should be concerned of. Brittany, have you been having a cough recently with any mucus?
Oh, no.
If she did, I would note the color and amount of the mucus. And if ordered, I would teach her how to deep breathe and use the inceptive spirometer. Next, we'll go on to the heart sounds. First, I'll begin with checking each area of the heart with both the diaphragm and the bell. I'll note the S1 and S2 and where they're located, where you can best hear them, and also if there's any adventitious sounds. All right, I'll be reaching right here. When listening, I could tell that the S2 was loudest at the pulmonic and aortic area, and S1 was heard best in the mitral and tricuspid area. At Erb's point, I heard them both equally. Now I'll check for any adventitious sounds with the bell. I didn't hear anything that I should be concerned of, such as a murmur. I also noted that her pulse at her apical area was strong and regular. Next, I'll be checking to see if she has any edema around her paraorbital areas, her ankles, or her feet. I don't see anything, so we'll move on. Brittany, I'm going to check your pulses, both your radial pulses, so if you could just have me feel those. That's 2+ bilaterally. Her tibial pulse is 2+ bilaterally. And her dorsal pedis is 2+ bilaterally. Next, I'll move on to her skin assessment. All right, so first, let me backtrack a little bit. If she had an IV, I would check the flow rate and the drainage site. Going on to skin, we would check for skin integrity, any lesions that we should be concerned of, the dressings, if she has any, and IV sites. She doesn't have dressings or IV sites, and I don't see any lesions that I should be concerned of, except, have you always had this mole?
Yes.
And how about these ones on your arms?
Yes.
Full life, awesome. So I don't need to be concerned about those ones. Next, I'll check some skin mobility. All right, she doesn't have any tenting, which means that she has good hydration. I'd also use a standardized test, such as the Braden scale, to check to see situations such as, I would check to see if her risk for skin impairment. This tests for things such as sensory perception, mobility, and friction and shear, along with her ability to move and moisture on the skin. Next, I will move on to her abdomen. So Brittany, I'll have you lay down, and I'll pull this out for you. Awesome. I'll be lifting up your shirt and just listening to the 4 quadrants of your stomach. First, I would note that it is flat and not rounded, or there's no distension that I should be concerned about.
Thank you.
Present. 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 And present. She has normal active vowel sounds in each of the 4 quadrants. Brittany, now I'm going to be palpating your stomach a little bit. I'll start with some light palpations and move into some deep ones. I am checking for any firmness, rigidity, and tenderness. So if you feel any tenderness, just let me know. Go ahead and relax, take a deep breath. All right, I'm gonna move this into some deeper palpations now. And the only thing that I'd note is that she has a small mass. It's most likely just stool in her lower right quadrant. All right, I'll go ahead and have you sit up now. In regards to stool, have you been passing gas or stool frequently?
Yes.
With your stool, what's the color of it?
Normal.
Normal, so like brown, black, green?
Brown.
Brown, awesome. And then characteristics. Is it liquidy? Is it solid, well formed, little pieces?
Solid.
Yeah.
Yeah.
Does it look dry at all? Like very dry?
No.
No? Okay, good. And about how often do you poop?
Probably once a day.
All right, that's good. Have you been having any nausea lately related to possibly your diet?
No.
Do you feel as if you're tolerating your diet well?
Yeah.
Great. So we probably wouldn't have to make any changes to her diet or advance it anyways. Along with that, if she had any stomas or tubes that I needed to assess, I would do that now, but she does not have any. You would check the drainage and the site to make sure there's no skin integrity problems. All right, now, if she had a catheter, I would check the patency and the drainage to check for fluid, color, clarity, and amount. So, Brittany, how often are you going to the bathroom, urinating?
A lot of times.
A lot of times? Would you say like what, 5 to 6 times a day?
Yeah.
Like pretty frequently? All right, what's the color of your urine?
Yellow.
Is it pale, is it dark?
Pretty pale.
Pale, all right. Is it cloudy at all or is it pretty clear?
Pretty clear.
That's good. And do you think that you're peeing a lot of amounts or really small amounts just all through the day?
A lot of amounts?
Do you feel like concerned with how much you're peeing?
No.
No? Okay, that's good. Along with that, I would check, I already stated I would check a catheter, and we'll move on to activity. If my patient were on bed rest, I would check the position of the head of the bed, and I would also implement a turning schedule. But since she is not, we'll move on. If there's any orders for SCDs, TED hose, or foot pumps, I would make sure that they're working properly. Brittany does not have those. Brittany, do you feel as if you are able to move about the room without any assistive devices?
Yes.
Sweet. How about going to a chair, going to the bathroom? Are you able to do that independently?
Yes.
Fantastic. Along with that, I don't know. Okay. Well, we'll just move into the closure. So I would move her, if we're in the hospital setting, I'd move her bed to the lowest position with the side rails up and give her her call light. Do you have any other concerns that you'd like to address right away?
No.
All right, fantastic. Thank you so much for your time.
Thank you.
And I'd wash my hands and give the patient privacy.